Welcome to Sustainable Stock. Real conversations about cattle, land, and the culture that surrounds them. From grazing and management to the weight of stewardship that cattlemen carry, we explore what truly sustains the herd. Brought to you by Boss Sires Genetics, functional, fertile, adapted genetics. Here's your host, Patrick Powers.
Hi, and welcome back for another episode of Sustainable Stock. Today I'm joined by John Atkinson of Cashmere Cattle out in Australia, Grant Vassberg of Kallion Farms here in Texas, and Dr. David Rainosek out of Arkansas. Sorry for stumbling over the name there. Today's conversation is one I'm genuinely excited about because we're going to step into a subject that a lot of cattlemen have quietly observed for years, but maybe haven't fully known how to explain it yet. More specifically, we're going to explore a theory surrounding long-term fertility, hormonal balance, and possible parallels between some modern cattle populations and conditions that, in human medicine, might resemble things like PCOS. This is something that started as a simple observation across multiple herds and slowly evolved into a much larger conversation. John and Grant, I'm just going to assume most listeners know who y'all are by now, but Dr. David, for those listening who may not be familiar with who you are yet, would you mind introducing yourself a little bit and also helping people to understand the role you've started playing within the research and observation side of what Boss Sires is doing?
Yeah, certainly. And thanks for inviting me. I'm an internal medicine physician here in Arkansas. I'm not a fertility specialist, and I don't know anything about veterinary medicine. But when Grant started talking to me about what they were seeing in their beef herds and a lot of the observations, it raised this question. Gosh, that's awfully similar to what we call PCOS in humans. And then I started acting as a little bit of interpreter and doing some legwork to find some studies, and we found a decent amount of evidence to support it in existing animal science literature that this parallel is probably real. And then that led to more and more conversations and ultimately this here. But yeah, I'm just happy to sort of contribute from my perspective as a biomedical engineer and physician in trying to interpret some of the available data and how can we construct a study to evaluate this going forward.
Excellent. Well, before we jump too far into a full-fledged discussion, I do want to say something very important. What we're discussing today is probably going to challenge some long-held assumptions within parts of the cattle industry. This episode is not to present a settled science, and we're not claiming to have every answer figured out. What we are doing is openly discussing a theory that emerged from repeated real-world observations surrounding fertility, embryo production, hormonal balance, and possible PCOS-like patterns in cattle. Some of what we discuss today is observational. Some of it is theoretical. Some of it may ultimately prove incomplete, wrong, or require refinement as more research is done. But we also believe progress only happens when people are willing to honestly compare observations, question incentive structures, and ask difficult questions out loud. So the goal of this episode is not to hand listeners a perfectly packaged conclusion. It is to introduce the conversation. Would you all agree to that?
Exactly.
Yeah, 100%.
All right, guys. Well, then I say we open the floor for this.
Sure. Well, I guess right off the get-go, I guess we can just kind of define the theory itself. And I know we keep bringing it back to PCOS, which honestly, David, I think here in a little bit, if you can actually define what PCOS is for us guys, or
Yeah, absolutely.
but I know when it comes to cattle, what we've seen, like we were saying, is observation, but across all these herds all over the world, that for the guys that have done embryo work, we've just seen that our cows tend to produce less eggs. And I know we can dive into it more here in a little while, but that's not what has been a popular deal, or lower egg production hasn't been something you brag about.
And I remember, Grant, when you sort of brought that up early with me, when you asked me when we had our first discussions about our success rates in artificial breeding as far as IVF and ET, that, when you sort of laughed when I said, well, we just don't have big numbers, so it's not worth the travel for a vet to come and do what we do. And, I guess I had that epiphany of relating it straight back to Mother Nature, that cattle and animals are far smarter than we are. Mother Nature's smarter than we are. And it knows if an animal, like a frog or something to that extent, has a low success rate of getting things through to adulthood, their progeny, they throw as many things against the wall, as many eggs in that pond as possible, to hope that a few of them are going to survive. Whereas we look at animals, the big five in Africa, for instance, they know that a massive percentage of their progeny are going to make it. So they only have, one calf every couple of years, because again, Mother Nature dictates it. We see it here in Australia. I think kangaroos are a good analogy for it, because they can dictate the sex based on the season, and I think that again, with humans try to outsmart Mother Nature, and it usually comes back to bite us in the ass.
Yeah. So, what are some of the real world observations of this? What inspired the thought? I know you touched on the low egg count and how it's not a braggable moment. Can we go a little further in that?
Yeah. No, what us guys, well, a lot of us breeders have seen in this Bossires group, which, I guess not surprisingly, a lot of them don't do embryo work, that they just do natural calving only. But for the guys that have dabbled into the embryo work, I guess the overall, the characteristics or the phenomena that we see is that these naturally fertile cows, which we'll get into fertility in a little bit, but the naturally fertile cows that are capable of giving you a calf every year or every 12 months, that they'll have a lower overall production of eggs. But specifically with IVF, we'll see that they have a low oocyte production, and they call it the development rate, but what percentage of those eggs turn into viable embryos after a week of incubating, that's a higher development rate. And then thirdly, the pregnancy rate itself, that these cows, if they're naturally fertile, their embryos are going to be more fertile and they'll have a higher pregnancy rate. And I think that's where a lot of embryologists have seen that if a cow comes in and cranks out 80 oocytes, 100 oocytes, whatever that is, that they'll tend to have a lower development rate. So, yeah, they might have 120 eggs, but as a percentage, maybe 20 to 25 become embryos. Now, we're just throwing rough numbers out there. But of those embryos themselves, when they go and transfer them to recips, the pregnancy rate is going to be a lot lower. So instead of hitting like a 60% preg rate, they're going to be cruising down at 10 to 20% preg rate. So I know a lot of embryo companies, I think a lot of it's the disconnect, but they're not really studying the actual fertility of the cow itself. But anyway, I know that was a rabbit hole there.
No, well, I mean, going down that, I talked to a cousin of mine the other day that does IVF in horses, which is called ICSI. And when I told her about the idea of this, she said, well, that makes a lot of sense. She's got a mare that only gives 1 or 2 eggs at a time. And yet, if she gives 2, a lot of the time she gets 2 pregnancies and 2 foals, whereas the industry norm is for them to give 10 to 15 and hope for 1 or 2 foals. And it sort of blows the minds of these vets down there that a mare that gives you 2 or 3 eggs will give you 2 live foals. It doesn't sit normal with their trends.
Well, Dr. David, how would you say that ties in any way with how PCOS would present itself? Are you hearing any commonality there?
Yes, and if you'll allow me, just I'll kind of quickly describe the syndrome in humans, and then I think you're going to see the corollaries. But and I should point out that as of a week ago, the Lancet, which is one of the premier medical journals for human medicine, published a big article on PCOS, renaming it PMOS, to emphasize that you don't have to see cysts on ultrasound, and we're missing a lot of diagnoses by emphasizing the polycystic piece of this. That really it's the metabolic syndrome that's the problem, the hormone imbalance, and that's kind of what started this train of thinking. But there's some criteria from maybe 20 years ago called the Rotterdam criteria to diagnose this condition, which I'm going to try to call PMOS now, but I may mess up here. But it's not regular ovulatory cycles, so subfertility, if not total infertility, and then excess androgens, so showing signs of, we call androgenation, but extra hair growth, weight gain, acne, these kinds of things, and then the polycystic ovaries that it used to be named after. You only have to have 2 out of those 3 to get the diagnosis, and it's a diagnosis of exclusion, meaning that we don't have a test we can just run. But the risk factors for it are primarily genetic. So we know this from twin studies that it's highly, highly heritable. The second or third largest risk factor is obesity, especially in pre-puberty. Early first menarche or early cycling is a risk factor, and then large birth weights are also a risk factor. I don't know if it's true in humans. There was a sheep study that showed increased risk with androgen exposure in utero. So in the developing lamb, if the female was exposed to higher levels of androgen from the dam, then they were more likely to have signs of PCOS or PMOS. And it's super common. I mean, estimates anywhere from 8 to 20%. So almost every person knows somebody with this, whether they're diagnosed or not. And so when I hear Grant and you, John, describe what you're seeing, this sounds very similar to what we see in PMOS patients, even down to the egg collection thing that if you stimulate these ovaries with FSH, like for a fertility treatment, you get a lot of eggs, and they tend to be subfertile eggs. So even that kind of has some parallels. But that's kind of the big picture of what PMOS is in humans, and I'm sure I'm leaving a lot out, and there's a lot more to it, but that's kind of the parallels that I see here.
Well, I can't be the only one hearing you describe that and making correlations with the beef industry. Our push for high birth weights, early weight gain in cattle, and let's call it obesity later. I think all those could be factors.
And that's
Well-
one of the main reasons for this name change, was to focus on the metabolic part of this, which is the obesity. I don't know if cows get diabetes, but the higher insulin resistance, the sort of cardiovascular disease that comes with the excess weight and these kinds of things.
Excellent.
No, quick thing, and this is, I guess, going back to our opening, that there needs to be more discussions on this. But yeah, David, I know when me and John are talking about large egg production, it's not just with FSH treatment, because I know like a lot of IVF, they just dry run them. Like the cow goes in and they're not having, some do stimulate, some breeders do, some don't. But I didn't know if humans, is that like, do the women, will they have a larger egg production even without stimulation? Like, do they just naturally have more follicles, or?
I don't know the answer to that. I
Gotcha.
think, when we're doing fertility treatments, which is a whole specialty outside my own, I need a caveat. They're generally giving things to help
There's something. Okay.
ensure that they get egg collection and stuff. So I don't know how often they collect without stimulating.
So, David, tell me this. In order to have a high egg count or follicle count, even using FSH, all that does is maturing existing immature follicles that are already there. Is that correct?
That's correct.
So those women, I'm relating it back to animals here, I guess. Those women, is there any data that you've got for a non-PMOS patient and what their results are if treated the same way?
They tend to get fewer eggs produced. I would say
Right.
primarily.
Yeah, no, that's what, using that as a control, the FSH work, just comparing like for like. That's sort of the one I wanted to understand. Right, that answers my question. Thank you.
With all this said, guys, I think it could really behoove us if we defined well what the word fertility means moving forward for this discussion, because it's currently very openly defined. Is anybody
Okay.
up to task for that?
You go for it.
Well, I mean, for me, the idea of fertility is that a cow, given the right fertilization, whether it's AI or natural service, that she has I'd say better than 80% chance of falling pregnant, holding a pregnancy through to calving. That
So
would
it
be my
goes
idea of fertilization.
So it would go beyond embryo and egg production.
Yeah,
Yes.
well, I mean, it doesn't prove anything just to say that they are high donors, and that's what I guess a lot of this is, trying to prove whether there's any correlation between artificial collection of embryos or follicles back to in the paddock fertility.
Sure. Well, and guys, I hope we do podcasts like this again. And I think this whole fertility deserves more discussion. But I know us in the Boss Tires group, like we've seen there is debates on fertility itself and the heritability of it all. But a lot of it is going back to how do you define fertility. And I think if you just go ask a old school rancher that owns cows, like, hey, how do you know that cow's fertile? He's going to tell you by how often she has calves or how many calves she's had, and he's not going to use an EPD or some kind of metric. It's like, how do you know this cow's fertile? It's like, well, she gives me a calf every year. That's sometimes it's going back to the basics.
Citing of hormonal balance and
Well, I mean,
reproductive efficiency.
David answered it before when he said that they're finding the PMOS is a genetic thing.
And Patrick, is it okay if I bring up a particular study here that
Absolutely.
Please.
I don't want to disrupt your outline too much here, but
We don't reference the outline. We don't reference the
okay,
outline.
got it. When I went and started doing a little bit of research on this analogy, we're not the first ones, obviously, to question this. And there's a group out of Nebraska led by a Dr. Andrea Cupp that has been doing research to try to elaborate the specific molecular mechanisms, you might say, in PMOS. And I don't know how it began, but they identified within their own research herd at the university about 15% of their animals had high androgen levels in the ovaries. And so they did a decade of ongoing research, still ongoing, to elaborate those pathways. But they found some really fascinating things, and so much so that they've started kind of calling these animals PCOS or now PMOS models for testing treatment for humans, because the biological pathways were so similar between human ovaries and these that had the high androgen levels. And so it's I don't know how far into the weeds we want to get, but with these higher androgen level animals, they found that they had 17% lower fertility within their own herd. And so they went out and they went to two more herds. One was another in Nebraska, a big research herd there, and then another in Jordan, and other side of the world. And they went and started testing animals. They went to a slaughterhouse in Jordan and started picking up ovaries out of these animals, and found 35% of them had the same thing, had these high androgen levels. And we're not saying 10 or 20% high. We're saying 10 times higher, and in some cases 100 times higher levels of androgens. And so they did a lot of analysis. Some of it I understand, some of it I don't, but that they found a really high proportion of primordial follicles in the high androgen cows. So immature follicles just had a single cell layer around them, versus the cows that were their control, that had relatively normal levels of androgens. They had significantly fewer. And moreover, when they took these ovaries out and put them into 7-day culture to see how they progress, it became even more extreme, that the the control cows that had normal androgen levels, those follicles progressed from primordial to primary, secondary, all the way to antral follicles. Whereas the ones with the high androgens, they were more or less arrested, that they showed a little development to primary and secondary, but nothing to antral. So they were arrested follicles. Now, they didn't see cysts on these ovaries. This was sort of microscopic findings. These are 1 and 2 millimeters or less follicles. But I think that speaks to this name change also, that you don't have to have ultrasound visible cysts to get this diagnosis, that it's really a metabolic and hormonal problem. So just fascinating, but that they looked at some of the mRNA messengers, signaling messengers that produce proteins in the cell, and they found the same pattern you see in humans with PMOS. They found increased levels of collagen deposition, which is sort of a scarring in the ovaries, which again we see in humans with PMOS. And so it really creates this naturally occurring model that you can experiment with. And then one of the later studies they did was they found a treatment that would help those follicles start progressing again, to help them move along to become antral follicles. So it probably is going to have some human results before it's all said and done, but just really incredible studies and research that they've done there.
Excellent. Well, John and Grant, I have a question for the both of you. How did Boss Sires find itself in a position to draw these correlations with this PMOS? How did Boss Sires find itself in a position to where there was enough accounts of this to construct this theory?
Yeah. I think what it is I guess we're in a unique position to where we're breeders of naturally fertile cows or functional cattle. But what's going on is, I think what puts us in this position is we're able to see, it's like, hey, what do my Brahmins have in common with John's Droughties in Australia, and like the Kinford Brahmins in Florida, or the Meitler's Herefords, to where even though we're of different breeds, which I know that's a whole other topic that we can go down for another day, but the fact that we all honed in on these naturally fertile cows, I guess what we're doing is we're seeing, hey, what do we have in common that is unique and that's different than the more mainstream counterparts within our own breeds. And I think that's what's been kind of fascinating, and what kind of led to the PMOS or PCOS comparison, or whatever you want to call it.
Would
Well, that
you
was
say
your
that
chat with David, wasn't it, Grant? You sort of had a chat to David and told him what we were finding, and that's
Yes,
when.
sir. Honestly, it was that, and there's some other embryologists that have been open-minded, and some of them don't like to be named, just because I know it's their livelihood. but actually, I guess this would be fitting. Is one of my a good friend of mine that's an embryologist. When I first contacted him about, hey, that we were seeing this phenomenon, he did tell me, he's like, Grant, he's like, 2 years ago I would have called you a lunatic. But his wife and him were trying to get pregnant, and she was having some fertility problems and had, I guess, what is called now PMOS. And one of the symptoms that she was showing was that she had a lot of follicles, or a large egg production. And that's where he's like, Grant, it doesn't sound crazy at all anymore. And I do know when we were first talking to some of these breeders, like I said earlier, historically it would be embarrassing to, you wouldn't go put on Facebook that, hey, look at my donor, she made 4 embryos. Like that's not something that breeders have done in the past. But I know when we were first contacting each other or talking to some of these breeders, I remember I'd tell them, like, hey, be honest with me. What is your cow's egg production? And even some of the Boss sire breeders themselves were reluctant to share that their cows had lower production. But then when we started developing this theory, which I know we're talking to breeders constantly, and it's just something that just every time we keep seeing it. And like, it was literally yesterday I was talking to an Angus breeder, and as soon as I told him about the theory, he had his epiphany or light bulb moment, and he was like, Grant, that explains everything.
Well, David, I do have a question for you if you don't mind me bouncing back your direction.
Certainly.
So, you're going to have to correct me again. I'm going to continue to call it PCOS. But would you say that you feel like a lot of this comes about from a hormonal basis, or is this environmental? Do you have any opinion in that regard?
I'm not sure it's really known what precipitates it, what starts the cycle. But what's clear is that the cycle is self-perpetuating, sort of like which came first, the chicken or the egg. When you have arrested follicles, you don't get progesterone from ovulation, and when you don't get progesterone, the LH frequency goes up, the surge frequency, and then that leads to more follicular arrest, and more androgenization, more testosterone, so to speak, that causes more immature follicles to form, and they can never quite get over that hump, or they have a harder time doing so. So there's also this metabolic cycle too. And when we're talking about diabetes, we talk about insulin resistance, and the same thing happens in PMOS, that you get increased levels of insulin resistance, which actually leads to more androgen production, and more androgens lead to more insulin resistance. So but how it starts, if it's known, it's not known by me, but once the process starts, it just tends to be this self-perpetuating cycle.
Okay.
Yeah. I don't, sorry for interrupting, but I do remember something that John and I did find fascinating in that study, David, was that the offspring of these cows, how they tended to have a higher weaning weight.
Yeah, it was about the only difference. They were the same weight, same age, same everything, but their weaning weights were substantially different. And even the authors, posited that perhaps that's how we ended up in this situation where 35% of naturally occurring herds, commercial herds, were having this androgen excess and and ovulation, this PMOS kind of syndrome. Was, if you're chasing big weaning weights, then this is going to be a natural consequence of that. Is ending up in this cycle more often.
Because I think that's where, to me, when I saw that and heard that, I was like, that makes so much sense on, if you look at the past 50 years of breeding, which is way before my time, but that's just this thing that your typical breeders do, is chase the weaning weights. And kind of like a low egg production, a lot of guys don't brag about an average weaning weight. They want to brag about, hey, my calf hit top the scale.
Well, it's sort of the other extreme over here a lot of the time now. Is it's high egg production is a selling point. That's what they're chasing. So, I mean, if this theory is correct, and that creates lower fertility, well, the last 15 years in Australia, effectively we've been mass producing sub-fertile and paying a premium for it, particularly in the females. I mean, when people are coming into a breed, they want to mass produce that expensive heifer they've bought, so they make sure she's out of a cow that produces 30 A grades or 80 eggs at a time. So they go and spend up on that one. And, if this is proven, as it seems to be in people, and it is obviously, I mean, we're all of the consensus that fertility is genetic. I mean, that's going to hopefully redirect a lot of the international herds back to a much more fertile animal.
I like that you open the discussion for the incentive behind the embryo industry. What is the incentive structure there? So there's the obvious reward of more eggs. Could you two cattlemen discuss that in any further depth for me? How this could open the door or close it in other regards?
Oh, well, I mean, it's not closing a door, because as Grant explained, the cows that are giving 10 or 12, or say 10 or 12 eggs at a time, you'll get 8 embryos and then you'll get 6 calves. So you're still able to mass produce them, but you've got the other cows that are giving you 50, and then you're still only getting 15 embryos, and then you're still only getting 6 or 7 calves. So the actual number of live calves may not be that different if you still want to artificially breed, but you just won't have the bragging rights of saying we just flushed 180 eggs out of this cow. And the thing it will probably affect is those studs that are selling embryos obviously want to flush the high donors because they're paid per embryo. So they will continually want to flush those 30, 40 A-grade cows. But that's been our hypothesis, if proven correct. That's been to the detriment of the buyer in an enormous way. And that's, I mean, we're not shutting a door. We're trying to redirect focus back to what is going to be productive and profitable for people, not just the studs that are, you know, and admittedly, it hasn't been proven or disproven in the industry, so I can't say they're doing the wrong thing, but there is a likelihood or a chance that it's been to the detriment of those buyers.
Well, I think another huge cost, John, it's not just the embryos itself, but if we're talking about a per calf on the ground, with these more naturally fertile cows that produce less embryos, the other benefit is you need less recips. Because like if you're having to transfer 50 recips to get 10 calves, well, now instead of needing to have 50, you can be running 15 to 20 recips. So the costs change on everything are, like we said, it's almost a wash on the number of live calves, but now you're only having to run less than half the number of recips.
And like you said, I mean, with some of the embryo tech companies, you know, some of them charge per live calf or per pregnancy, but a lot of them charge per embryo, and certain parts of it, you know, you'll be paying the lab fee per fertilization or per egg count. So, I mean, if we can pull that back for the producer, it's going to obviously drastically reduce their cost in the lab as well.
Yeah. I think we're all this consensus that I don't think any of us are here to destroy embryo work per se, but it's just like, hey, I think we're just going to have to restructure the business model. And if these companies can get back to per pregnancy, I think it's a win-win for everyone.
Oh, I agree. I don't want to destroy the industry. It is the one way that you can mass produce your better animals, but we need to redirect everyone's thinking about what is the best outcome out of it. You're better off having 4 heifer calves out of your most fertile cow than having 8 out of your least fertile naturally cow. This is correct.
Absolutely.
All right, guys. Well, if y'all are ready to shift this a little bit, I'd like to discuss the separation between observational science and modern science. Maybe in how much of the observations that were made that shaped this theory were missed and also supported by modern science. Do y'all have anything to say about that?
It's an interesting point. You know, for most of human history, science has been an observational one. I mean, it's we make observations, people write them down, they just sort of collect observations and kind of speculate on conclusions. Sort of the modern scientific method lets us test those observations and see if we really understand things correctly. But I think to be scientific about it, I think we're starting at the right place, which is collecting a lot of observations here. But then the next step is obviously to apply scientific method to it and see can we impact outcomes, by using this information, because information that doesn't affect your outcome is just decoration, but as you guys have discussed, this has substantial impact on everyone from producers to genetics companies. So yeah, I think trying to engineer a study for this is worth whatever effort it takes to do.
Well, Patrick, I don't know if this is right or not, but and not trying to pick on the guy that was talking to us on Facebook, about, I guess, and we welcome people to talk or have discussions, obviously. But Patrick, I know you're good at summarizing or putting it into the right kind of words, but with and I think was the discussion over the heritability of fertility and the problem that he was having is that he was saying that, yeah, the outcome of what y'all see out in the field is highly heritable, but all the inputs or everything that goes into that outcome, it's hard to measure it all, and it's and those individual components of fertility are lowly heritable. So he's like, so genetically, fertility is lowly heritable, but the outcome is highly heritable, and that's where I think that was the disconnect.
A plus B equals C, and he couldn't figure out what B was, so C obviously wasn't the answer.
Even though he was saying C is the answer, but that's where.
Yeah, I know.
I've heard. I had never heard this before I met you, Grant. That fertility is lowly heritable in cattle, and that's the mainstream thinking, that's what's taught in schools more or less. Just kind of blows my mind. That like John was talking about earlier with the natural world and reproduction. I mean, if fertility is lowly heritable, then the one that has highly heritable fertility is going to win out every time and be able to pass it on to future generations. And it would make cattle sort of unique among living creatures to have lowly heritable fertility. So,
well, David, how much does that skew the future research if you start with that principle?
Yeah, it's a good point. And some of the folks we've talked to have basically poo-pooed this idea or others based on the premise that why do a study related to that? Why look into that? Fertility is lowly heritable, to exactly your point.
Yep. But I guess for the audience, we're all in the consensus that it is highly heritable in cattle.
Absolutely.
Right.
Yeah.
Yeah. Well, jumping back to David's earlier statement about the need to involve modern science in this, how are we going about that? How is Boss Ayers taking that step to take this beyond theory?
We've talked to some universities. We actually, Grant and I called and set up a meeting with the lead author behind this PMOS study that we were just referencing to kind of get some more background and her perspective. And it was just a humbling experience to talk to a real scientist. I'm just sort of a country doctor here, and to hear what years of culmination of years of work was pretty thrilling. But trying to establish relationships with universities so that when we do set up the study, we can hopefully include some postdocs. Panama's considering letting us using their research herd, so maybe have a multinational input. And then if we're going to do the study, measure as many things as we reasonably can. And I know everybody has a little bit different perspective, and each sort of research group, each university has something different they're sort of fixated on or working on. And if we can combine those in a productive way, then maybe we can, do the whole thing for relatively less cost per entity.
Well, I guess one thing that I know we do invite anyone to replicate or duplicate. But I know we've done our own field trials on a couple different herds here in the States. And I've talked to universities about this. But just on the basics of it, or basic field run that someone could do is when you go and palpate a group of cows after bulls have been out. So just like a typical cattle operation, or how a lot of guys do it. So say 2 months after the bulls have been out. When you go and palpate the cows, just use an ultrasound machine, and you can ultrasound the ovaries right then and there. And granted, we've only done this on a couple of herds here in Texas, but both herds showed that for some reason, all the pregnant cows had a lower overall follicle count, and the open cows would have twice as many follicles. And so I know that's like a very inexpensive way just as for someone to see, hey, there's some credibility behind this concept. And I do know, like, the one herd that we did down in San Antonio area, the breeder, he wasn't trying to trick us, but he was doing his own test, if you want to call it that. And at the very end of the run, he sent 6 cows into the squeeze chute that he was purposely taking to the sale barn for them being bad or being bad breeders. And at the very end, he did ask the embryologist that was doing the scanning. He asked the embryologist and me, "Hey guys, how are those last 6?" And that's where I know the embryologist was semi reluctant to tell him, but he did tell the breeder, "Sir, those were your quote unquote best donors. Those cows, their ovaries were now I saw the ultrasound machine, but they were lit up like a Christmas tree. And that means like essentially 30 plus follicles on each side. Um, so the breeder, that's where he even had he asked the embryologist, like, "Sir, is this theory true?" And the embryologist, once again, was kind of reluctant, but he was like, "Yes, after running these 100 head today, it's hard to say no."
All right, guys. Well, perfect world. We get this into institutes and we get into research herds and we start having some findings. What do we hope to come from this? We hope for people to build better herds. We hope for people to finally value the correct females within their herd. What does this world look like after this is either confirmed or denied, or affirmed or disproven?
Well, I guess if it's affirmed and the theory is correct, and part of this, I guess, by doing it, if we can do the scans on the animal post calving, pre joining, that is, we get them as a control group. There's no bull bin anywhere near them, no pregnancy, no CL, none of that's fluctuating hormones. They're all on a level pegging. And then purely going off the fact of pregnancies and open cows after that to work out if on a graph, once you're above 30 follicles, your chance of being pregnant decreases by X amount or whatever the follicle number is. And at the same point, if we can also assess them visually at the point of scanning, or it can be after that, it doesn't really matter. But if we can assess them based on their physical attributes that we all talk about, the feminine expression within themselves, to be able to say, well, 80 out of those 100 cows will be fertile, and then it'll be interesting to see if they therefore have a lower count, and then also interesting to see how the pregnancy goes beyond that. So that if we do it all as a blind study where we don't know the outcome yet, it's the only way for us to really be able to say hormonal expression in the physical. One of the ways it shows up is high egg numbers, and then it also shows up in a low pregnancy rate at the end. If we can do all that research to find out whether this is true or not, then we can get people, I believe, because straight away that comes back to your profitability of your business. We can get people to look at a bull, because that's the biggest effect you'll have on your herd when he gets 30 to 60 calves in a season. If we can get them to assess them for the correct traits, that's going to have a long-lasting effect on your herd that's positive with all his daughters that stay in there. That's what I'd love to see come out of this. And yeah, if it's disproven, well, we threw a ball in the air and it didn't land, and that's fine. At least we have some sort of industry relevant research that we can either prove or disprove it. And I mean, that's what we've talked about. If anyone has theories or opinions like that, then let us know, because, we need to be doing research into our industry to make us all more profitable and productive.
Well said. Anybody else have some closing statements?
Yeah, well, I know what John was getting at. I guess for the audience out there, what we are wanting to prove also is the bondsman angles, and because I know, not trying to throw dirt, but when Dave and I have talked to some researchers in the past, we've tried to tell some of these researchers that these hormonal imbalances express themselves phenotypically, and we kind of got laughed at. That no, it's impossible for a cattleman to visually assess the fertility of an animal, which we know is that's just not the case. But which I know that's gonna hopefully we're producing other videos or having John and Darius and to better illustrate some of these principles. But that is something we're wanting to tackle, and with the universities we've been contacting or hopefully working with soon, that is part of the initial research we want to do is that no, cows are supposed to look different than bulls. And I don't know why in humans I guess that has been a debate recently in humans, but most people can tell that no, men and women are different. Why should it be different in cattle? Which, David, I'm not, I know you brought it up earlier, but with the assumption that fertility is lowly heritable in cattle, that's why a lot of this hasn't been researched. And that if you flip that assumption around and say, no, fertility is highly heritable, that just opens the door to all kinds of research. And I know that's why with Boss Tires, we're very excited about possibly tackling some of these subjects.
Well, as you just said then, Grant, what David said before, how come in Mother Nature we all know that males look different to females? And usually it's for territory, dominance, all of that to impress a female by your size or protect your females. Why is it that in cattle that's not what we're selecting for? I mean, we know it's true. You look at the mane on a lion or the crest on a stallion. I mean, it's all the same stuff, and it seems ridiculous that cattle scientists want to believe that it can't be expressed in cattle.
I mean, don't shoot the messenger. That's
Oh, I know. I talked to a university here the other day, and I explained exactly that to him, that part of this is that we want to prove that. And he just said, oh, there's a few PhD boys that are going to be a bit upset with that idea. And I just said, well, and I mean, he'd heard of Bonsma, and I mean, it's all about that display of dimorphism between the sexualities. And like you said, it's there in people as much as a certain portion of the population want to believe it's not. Men are meant to be shaped a certain way, and women are meant to be shaped the other way.
This may or may not be worth including in the thing, but just as an interesting aside, there was a study done maybe 15 or 20 years ago now, and they looked at human cultures around the world, and their degree of sexual dimorphism was inversely proportional to the degree of monogamism. So the more monogamous the culture was, the less sexual dimorphism they saw. And in cattle, we see, bulls that, like you said, breed 30 or 60 cows in a season. That would seem to be sort of on the opposite end of the spectrum. We would expect in that case a lot of sexual dimorphism.
Yeah, well, I mean, what we find is the bulls that get you 60 in a season, they are the testosterone-fueled virile ones, yeah. Whereas the bulls that are confused, shall we say, they're the ones that lay under a tree and every third day go and smell a cow. And I mean, they're the ones we want to weed out to be productive and produce more kilograms of beef around the world to feed more people.
Excellent. Well, guys, I'd like to thank each of y'all for coming on today and participating in the discussion. And as we invited our guest earlier, I think it's very important that we do highlight that this was a discussion. There are points made today that could be proven invalid, and we're up for that challenge. The most important thing is that these discussions are being had. So we would invite all listeners to participate, become a part of the greater discussion, talk about your cattle. Would each of you agree?
Yeah, no, 100%.
No, I'm not trying to take away from what you're saying, Patrick, but I know that's some of the joy we find working with all these producers everywhere is we are getting some crazy, I say crazy theories, but some wild stuff that's coming from just old school wisdom that is being lost. And that's where, we're challenging the listeners, not challenging, but reach out to us, because there is some cool stuff that's making sense, and it'd be fun to prove that some of these old timers were right this whole time.
We're trying to reconnect the observational part with modern science.
Absolutely.
All right,
We got a
guys.
smart guy, David, to back us up.
That's right.
Yeah, no, it's
All
all
right.
on you, David.
But with all that said, I think it's time we say goodbye. So as always, don't forget to ranch with purpose and breed for the future.
Thanks for listening to Sustainable Stock. If this episode gave you a deeper appreciation for the people, the land, and the cattle behind your beef, like, subscribe, and share it. For full video episodes, follow us on YouTube. This show is brought to you by Boss Sires Genetics, your source for functional, fertile, adapted genetics. Until next time, stay rooted in common sense and connected to the herd.